FET stands for frozen embryo transfer. In frozen embryo transfers, we carry out transfer of previously vitrified embryos in either of the transfer cycles, a natural cycle or a modified natural cycle or a HRT or a hormone replacement transfer cycle. There are pros and cons for each of these methods. A purely natural cycle is actually the best cycle. Every woman is supposed to grow a follicle every cycle, and if we track that follicular growth and plan the embryo transfer based on the ovulation of that follicle, then this is the natural cycle. This works best. There are no need for medications, and the cycle is most easily tolerated by the woman. However, all women do not qualify for these cycles. Women who are at menopausal stage, who do not grow their eggs regularly every cycle, or who have come from abroad for an IVF cycle and cannot possibly afford a cancelled cycle, they would not want to do a natural cycle. Because in spite of best of your efforts, cancellations are high because the ovulation may be missed by the clinician in some cases. A modified natural cycle is where we induce the follicular growth with the help of oral medications or injectables. In certain cases, this works fine, especially in women with polycystic ovarian syndrome who would not be growing a follicle in most of their natural cycles. This treatment cycle is also easily accepted by the patient. But in some cycles, again, we cannot carry out even a modified natural cycle, especially in women who are approaching menopause and have come for an embryo transfer. So this brings us to the commonest performed FET cycle protocol, that is the HRT protocol. HRT can be applied to anybody, somebody who has regular cycles, or somebody who has PCO with irregular cycles, and also somebody who has stopped her menses and is now menopausal. In this cycle, hormones such as estrogen and progesterone are administered from outside to prepare the endometrium and get it ready for the embryo transfer, which could be chosen to be done at our desire. Logistically, this is the best protocol. We can choose the time of transfer. But there are concerns that in some women, miscarriages may happen, or they may develop PIH, that is pregnancy-induced hypertension, or PET, which is toxemia of pregnancy, a potentially fatal condition as well. So, the decision to choose the right kind of protocol to carry out an FET has to be taken with due consideration. In most cases, FET in a natural cycle setting is the best protocol. In certain other cases, we may have to resort to a modified natural or a HRT cycle. During those times, we need to exercise due precautions and make sure that we do not go wrong. So, in most cases, we feel a frozen embryo transfer in a natural cycle setting is the best. There are patients who may require a HRT or a modified natural cycle protocol as well, but we need to be careful and be mindful of the complications as discussed.